It seems like all things anal play are ready to be unleashed by many, and I am here to be your partner in your anal sex exploration. Recently, somebody left me a question. Will the anus remain open or dilated after anal sex? Great question. I am glad you're asking. Let's explore the anal structure and how does it do with anal sex so you can be informed and practice your sex safely. I am Dr. Tanji, the Sex Doctor Board Certified Clinical Sexologist, and your most trusted, honest, and fun sexpert on this platform. If you are new to my channel, welcome. I am so happy that you found us. We're a global sex-positive community that gathers here to discuss all things human sexuality without judgment or taboos, and would love to have you subscribe so we can continue to reach far and wide. You may also become a member of the Sex Curious or Sex Intelligent Club for exclusive content not available here. So, what are you waiting for? I know you want to. Subscribe. Thanks. Now back to the question. Will the anus remain open or dilated after anal intercourse, or will it close back up? Maybe you have seen this in porn and are wondering what happens to the anal opening after it undergoes toy or penis penetration. Will it close back up and remain tight, or will it stay open? Let's see. The anus does not typically remain dilated after anal sex if the process is done gently and safely. However, certain factors can influence how the anal sphincter responds after anal intercourse. Here's an overview of the anatomy of the process involved. The anal sphincters, first and foremost, what are they? The anus is controlled by two primary muscles. The internal anal sphincter, which is a smooth muscle that is involuntary and keeps the anus closed at rest, and the external anal sphincter, which is a striated muscle that is voluntary and provides additional control over the anus during activities such as defecation or anal sex. So what about dilation during anal sex? There's a temporary dilation during anal sex. The external and internal anal sphincters naturally dilate to accommodate penetration. The degree of dilation depends on factors like the size of the object or penis involved, the level of relaxation of the person engaging in anal sex, the use of lubrication, the pace and care taken during penetration. This dilation is typically temporary, and once the stimulus or pressure is removed, the muscles typically return to their normal resting state. And what does the post-anal sex recovery look like? After anal sex, the anus generally returns to its normal contracted state. The external and internal sphincters work together to close the anus, and in healthy individuals, the muscles should remain or regain their usual tone within a few minutes to hours. Any significant or long-lasting dilation would typically be the result of injury, trauma, or frequent rough anal intercourse. There are some factors that could lead to prolonged dilation of the anus, including excessive or rough anal sex. If the anal sex is too forceful, too frequent, or done without sufficient lubrication, it can strain the anal sphincters. This may result in temporary laxity of the muscles. In extreme cases, it can lead to a condition called anal incontinence, where there is difficulty controlling bowel movements. Pelvic floor dysfunction. Regular trauma or overstretching the sphincters may, in rare cases, cause long-term weakening or dysfunction of the anal muscles. Age and tissue elasticity. As a person ages, the elasticity of the tissues, including the muscles around the anus, can decrease. This can make the muscles less responsive to stretching and cause a longer recovery period. So, what can you do to recover and retain muscle health when you practice anal sex? After anal sex, the muscles of the anus should generally recover quickly if there has been no injury. Kegel exercises or pelvic floor exercises can help maintain or restore the muscle tone, especially if the anal sphincters have been stretched or weakened. Regular strengthening exercises are often recommended for individuals who engage or experience anal incontinence or feel they have lost muscle tone due to frequent or rough anal sex. If you are concerned about anal health due to frequent anal sex, these are the signs of injury or damage to the anus that you should be looking out for. If there is prolonged pain, swelling, or difficulty controlling the anus after anal sex, this could indicate muscle damage or injury to the anal sphincters. This would require medical attention, and the individual should avoid engaging in anal sex until proper healing has occurred. In some cases, if the muscle tone is not returning to normal, this could indicate more serious conditions such as anal sphincter injury or nerve damage that may require evaluation by a healthcare professional. In summary, for most individuals, the anus will not stay dilated after anal sex. The sphincters should return to their normal resting position once the partner or the penetration has ended, provided that no injury or excessive force has occurred. Safe and gentle practices, people, such as using adequate lubrication, going at a comfortable pace, and ensuring proper relaxation can help minimize the risk of prolonged dilation or injury. Also, remember to keep open and honest communication to ensure a positive experience during anal sex for everybody involved. And if anal penetration feels uncomfortable or painful, speak up, adjust the position, slow the pace, or stop altogether, or try some other time. Don't force it, please. Just stop it. Remember that if you or your partner experiences ongoing difficulty or discomfort with anal sphincter function after anal sex, it is important to seek medical advice, as this could be a sign of a muscle injury or other health issues that need attention. This is Dr. Tanji, the sex doctor, and as always, I wish you great, pleasurable, and safe sex. See you next time.